gros bout de ton témoignage, sou pa gen cœur, gen photo pas capable wè la donne. Eh bien, yon client qui te genyen gangrène, hypertension, ok? Gangrène c'est côté que le moun fait diabète, li pas traité, li vin attaquer pied moun nan, puis a vin tout noir, eh bien c'est coupé pour couper. So sou pa gen cœur, gen quelques photos qui pral passer ou gen doit pas ka garder pour état pied monsieur a te, après bon Dieu dans celle-là produit atomio mettez le camper sous deux pieds. Ou pral tande témoignage monsieur, yon sou besoin garder full vidéo ça. Ou ap jwenni nan YouTube mwen ki se Help for All. C'est pas haïtien lié, c'est en anglais vidéo en yé, mes amours. So, produit atomi sa yo, pa genyen pase yo, depuis ou suivre instruction que yo ba ou, nous pral tan de monsieur kap témoigner.
First of all, I just want to give God all the glory because he's the maker and creator of everything.
Indeed.
And with this, I believe it's Manuka honey. Man, this is a blessing in my life. And I thank God for my mom because she introduced me to you all products. I had been suffering from diabetes, high blood pressure, and I messed up and had a diabetic foot ulcer. And those things are very dangerous. I messed around and got a foot ulcer and my foot swole up. And I'm telling you, gangrene, I mean, you could get amputated, you know, if you neglect it. And so I had went to the doctor, and when they first looked at it, they gave me a shot, a technical shot, but it was getting worse. And so, to the point, I called my mom, you know, Francis Register. I called my mom, and she was like, well, you need to use some of our products. It's been great things I heard that Manuka honey and Hilo Him, what it could do for you in this situation. And so, long story short, I started taking the products, and I was taking the Hilo Him, and I was using the Manuka honey. I would take it, and I would put it on my foot. You know, it was swollen and full of, you know, discharge and different stuff. It was really nasty. But that Hilo Him, it really healed my foot. When I had the sore, it healed it. Over time, it stopped the discharge. The swelling went down. And so that's when I had built up a nerve to go to the doctor, you know, because I was missing a lot of days on my job, you know, dealing with this. And so when I went to the doctor, of course, he excused me and gave me 4 to 6 weeks off the job. But he was so amazed when I came in there because they've been seeing foot ulcers and they was thinking, okay, basically he may have to be amputated or whatever, because they asked me, had I been to the doctor and had any treatments before I went and let him saw it? And I told him no. So they had already made up in their mind that it was going to be worse. It was going to be bad. But when the doctor saw my foot, and he was like, so who have been taking care of you? What wound care been taking care of you? And I said, nobody. He said, you been doing this yourself? And I said, yes, sir. I mean, I was cleaning it, you know, and everything, peroxide and Neosporin and the Manuka honey. That was my antidote, you know. And so I said, no, I've been taking care of it. It's like, what? You know? And so he called a nurse, and they took pictures of my foot. Nurses was amazed that my foot was healing. So the doctor, he said, well, I mean, all I can do, tell you is to continue to keep dressing it and cleaning it. But he said, I'm going to send you to the wound care next week so they can put your foot in a wound vac and suck the remaining of the discharge. And that was a week later. I'm trying to make it short. And so
take your time, please take your time.
and so I kept putting the Manuka honey on there. And the next week, when I went to the wound care specialist, who's supposed to put the wound vac on it, when the nurse looked at my foot, she was like, who's been taking care of you? I mean, what wound care? They did a better job than me. They did a better job than what we would do. And I said, I haven't been to no wound care. I was giving, all glory to God, And so she took a picture and she called the nurse to come look at it. And so they was all amazed. And then the doctor got in there. And when he looked at it, he was like, man. He said, who took care of you? I said, I've been doing it myself. He said, man, you've been doing an awesome job. And he said, you see here? Because the sore had gotten smaller. And so he said, you see here? He said, these are blood vessels forming in your foot. Because the Manuka honey had replaced them. Ooh. My blood vessels came back in my foot. He said, these are blood vessels. And he said, wow.